Hi, everybody. Today's lecture is going to be on the second part of the central nervous system. Last lecture focused on looking at the brain, identification of the different structures of the brain, and also focusing on the functions of the cerebrum. More specifically, the gray matter of the cerebrum called the cerebral cortex. Now we are moving on to the next part of the brain called the diencephalon. So diencephalon is made up of thalamus and hypothalamus. There's technically a third part called the epithalamus, which is associated with the sleep and wake cycle and connects to the hypothalamus. I don't go into details about that though for your class. So thalamus is the oval-shaped structure we have here, and hypothalamus sits right below that. I kind of look at it as the head of the bird and the beak of the bird. And then hanging from that, you have the pituitary gland, which is depicted right here, and again here in this picture right here. Now, combination of the thalamus and hypothalamus together is known as the diencephalon. Now, what is the importance of the thalamus? The thalamus is important in terms of receiving data from all of your senses, and there is an exception, so make the exception, except your sense of smell. And what it does, it basically, after receiving the data, is direct them to the region of the cerebral cortex. Let's look at an example. Let's say data comes from your ears, your sense of basically hearing. So the hearing data first goes to the thalamus. Thalamus adjusts the signal and figures out that this signal needs to go, and it is from your ears or from your sense of hearing, and it sends it to the temporal lobe. So if I ask you guys basically in few words, describe the function of the thalamus, a lot of people say that thalamus is the gateway to cerebral cortex. Because again, all the signaling that we have goes through the thalamus first, and the thalamus is the boss that makes the decision to which lobe that signal needs to go. Again, there is an exception. Your sense of olfactory or sense of smell does not go through the thalamus. Hypothalamus is the area that sits right below the thalamus. Extremely important in terms of your survival. One of the main things that it does, it controls multiple homeostatic feedback or systems. These systems include your sleep and wake cycle. It includes your hunger and thirst, and it includes your body temperature. So these needs to be balanced, making sure that you are surviving in your environment. So all of these are identified as the homeostatic feedback system, controlled by hypothalamus. It also controls the release of hormones from your pituitary gland. So pituitary gland, again, in this picture depicted as the structure right underneath. So it is extremely important. It also controls the sex drive and pleasure. It is also control autonomic nervous system. So autonomic nervous system were things like sympathetic and parasympathetic, which is your fight or flight or rest and digest system. So it does have a role in controlling your nervous system in terms of the autonomic branch. Please do note that even though I mentioned some functions here, these are not the only function associated with the hypothalamus. There are quite a few functions for this structure, even though it's relatively small. The one that I do want to talk to you guys about, and again, it's the sleep and wake cycle, so I'm going to write it down for you guys. So what we identify as a sleep and wake cycle is controlled by a hormone called, and I don't know, you may have heard of it, by a hormone called melatonin. Melatonin. So melatonin is actually, this hormone is produced by a structure of the brain called epithalamus. Epithalamus. And epithalamus is under the control of the hypothalamus. So, in another sense, epithalamus produces the hormone melatonin, but this hormone melatonin cannot be released from your epithalamus until your hypothalamus sends a signal that it is okay for that hormone to be released. So, technically, your hypothalamus is the one that controls your sleep and wake cycle because it controls the epithalamus and the release of the hormone melatonin. The next structure we have in our brain is cerebellum. So cerebellum is located in the posterior aspect of the brain. And it's important in terms of controlling balance, muscle movement, and coordination. So cerebellum is one of those structures that in babies, it's not fully developed. The myelin sheath, that is the installation of the neuron, is not fully developed. And therefore, babies or newborns do not really have control over their muscles. And again, if you have ever seen a newborn or even a baby that is a few months old, there is nothing coordinated in terms of their actions. They're blinking eyes, they can't hold their head up, they cannot grasp anything, right? No muscle coordination. However, during the first 2 years of the life, you do notice a significant change in terms of their action, which basically implies that those changes are directly connected to the cerebellum, because as cerebellum develops during the first couple of years of the life, the myelination starts to form, which means that movement of the system becomes much more effective, and the movements become much more coordinated. So if I ask you guys, in another sense, write the function of the cerebellum, it is also can be described as coordinated. It's ensure coordinated and a smooth movement of a skeletal muscle. So, and if you have been around a child, you notice when, for instance, they start to walk, they fall a lot, they don't have a balance, they don't bend their knees properly. But again, as months pass by, you do notice that coordination becomes a lot better, the movement becomes more fluid, and all of that is because cerebellum is developing. Last part of the brain we're going to talk about is brainstem. We talked about brainstem broken down to 3 parts. The superior part that is right underneath the thalamus is midbrain, followed by the pons, and then followed by the medulla oblongata. If you continue medulla oblongata farther down, that becomes your spinal cord. So what are some of the main functions of the brainstem? Midbrain is responsible for adjusting sensitivity of the eye to the light and ears to the sound. It also gives you the ability to track objects with your eye. So instead of moving your head continuously, you actually move your eyes until the object is out of your field of view. That's referred to as the visual reflexes. Again, turning your head toward the sound would be another, which is also known as auditory reflexes. Now, please do note that even though I'm mentioning a very brief function with midbrain is extremely important. There's a lot more function associated with midbrain just other than what I'm simplifying right here for you. Pons is the second structure. In one way, you can say this is the bridge between the brain and the spinal cord, as it basically connects the upper part of the brain to the lower part of the brain. But the one that I also want you guys to know, this is also identified as the secondary respiration center. This is the part of the brain that is basically going to be responsible for partially, but as a primary source, control your respiratory act in terms of depth of breathing, number of breath, etc. Medulla oblongata is another important structure. Medulla oblongata regulates your heartbeat, breathing, and vasoconstriction, or changing the diameter of your blood vessels. So in another sense, we identify medulla oblongata as your primary cardiovascular center. Cardiovascular, again, it controls your heart rate, and it controls your blood pressure by adjusting blood vessels, adjusting blood vessel diameter, like vasoconstriction, vasodilation. It is also identified as your primary respiration center, which again implies it controls your movement of the skeletal muscle or movement of muscles in terms of respiratory or respiration. So medulla oblongata and pons both work in terms of your respiratory center. The second main function of medulla oblongata, or third, I guess I should say, is responsible for the reflexes or reflex actions in your body, which includes vomiting, hiccuping, swallowing, coughing, which are, again, not under our control, hence the word reflex center. In terms of the brain parts, we also have a structure called limbic system. Limbic system is the part of the brain which you can see in orange. It has different parts actually, which includes amygdala, hippocampus, but the main function of the limbic system is controlling over self-gratifying behavior such as hunger, thirst, and sexual desire. It also helps you guys to connect to your primitive emotions and mental functions. For instance, it can give you feelings that are good and help you create positive memory for things that are pleasurable to you, versus creating negative effects and feeling of a stress for things that are unpleasant for you, and help you create negative memories for them. Limbic system is very tightly connected to your sense of smell. So in many cases, if you look at your senses, the sense of a smell would create the strongest emotions in you, yet it be positive emotions or negative emotions. So both of these are associated or directly ties into the limbic system, and limbic system connects to the sense of smell. You can see the olfactory bulb as in being directly connected and being part of the limbic system. So kind of switching gears right now, we are going to spend a few minutes looking at some of the conditions that are either short-term or as a result of trauma, versus as a change over time, creating chronic conditions for the nervous system. So let's start. One of them is subdural hemorrhage. Subdural hemorrhage is a result of some sort of force or trauma that causes the rupturing of the blood vessels that are supplying the brain. That causes the blood vessels to leak into the intracranial space, which is basically the space between the skull and the brain. Now, understand that when this bleeding starts to happen, there is no way for this blood to be drained. It is also basically placed in a space, and one side is the skull, which is a hard matter, versus the soft brain tissue. So as the blood starts to pool, it cannot push away the skull, so it pushes down on the brain tissue. So as the blood starts to gather, we start with a person that has no symptoms at the beginning of the bleeding, and as time passes by and the pressure inside the brain becomes more and more, as a result of the bleed, the person starts to lose their speech, or even if they can make sound, what they're making does not make sense at all. It more sounds like gibberish. And then they lose consciousness shortly after. And if they are not treated for the condition, it will lead to loss of blood pressure and respiration and a relatively fast death. Treatment, if it's caught on time, and if the person has access to medical system, they will drill a hole inside the skull and allow the extra blood to be drained from the cranium. And they do need to also fix the damage, otherwise the bleeding will continue and therefore will result on the continuous problem. In this picture, you can see the gathering of the subdural hemorrhage or the blood being pulled inside the skull. What you see as the white borders, that's the skull. This is a transverse cut, so they literally cut the brain through horizontally. You can see on the left-hand side, the brain has extended all the way to the skull. But in this side, you have this black area, and this is basically pooling of the blood in the right hemisphere and stopping the brain from basically functioning properly. Another condition we have is called cerebrovascular accident, better known as a stroke. A typical reason for a stroke, not the only reason, just we're simplifying it for our class, is if you have a blood clot that is basically blocking part of the brain, the blood supply to the brain. So if part of the brain does not receive that oxygenated blood, it will result in the neuron death in that region, and therefore the loss of functionality. So if somebody is dealing with a stroke, one of the most common way of identifying that, or most common symptoms of a person, is paralysis of the opposite side of the body and sensory deficiencies, as well as loss of speech. Now, the reason that the paralysis happens in the opposite side of the body is because of a concept called contralateral. Contralateral means the right part of the brain controls or collects data from the left part of the body and vice versa. So the concept of contralateral means that if, let's say, the right side of the brain is damaged, your sensory data and motor data on the left side gets affected, and vice versa again. Another medical condition that we have, which is unfortunately very degenerative disease affecting many elderly, is Alzheimer's disease. By just looking at the picture of a healthy adult brain versus a person that has Alzheimer's, you can see a significant difference. This is a healthy brain versus an Alzheimer's brain. You notice the brain almost looks deflated. If you look at the frontal cut of the brain, you can see that a lot of the brain tissue is actually missing. So this is where Alzheimer's is a result of a protein plaque built up inside the brain. So as this protein plaque is built up, neurons are not receiving their nutrients, therefore they're slowly being destroyed. And as they destroy, basically they get cleaned up. The neighboring neurons die because they lost communication with the original neurons, and basically this process continues over and over and over until many of the neurons in the brain tissue are dead. Please do note that the neurons cannot be regenerated. So if you lose a neuron as a result of either stroke or Alzheimer's disease or Huntington disease, those neurons cannot be replaced. So if you lose them, you have lost them forever. Typical symptoms of a person with Alzheimer's is memory loss or shortened attention span, But again, please do note that if the condition is in extreme cases, other functions or typical functions of the body that basically keeps the person alive also starts to go. I'll come back to this slide in just a minute. Actually, let me continue with this. Sorry. We already talked about this. This is nothing new. This is the picture that I draw for you on the previous PowerPoint. We have the sulci, or the shallow groove, that is separating the frontal lobe from the parietal lobe. The area immediately in front of the central sulcus is the precentral gyrus, and this is kind of a recollection or review, would be responsible for voluntary muscle control or voluntary muscle movement. The area right after the central sulcus is called postcentral gyrus, and this is responsible for receiving data from one specific sense, which is your somatosensory, or your sense of touch. And I believe the rest we have already discussed in detail. Now, talking about the spinal cord, the spinal cord I already mentioned, it is seen as the highway between the peripheral nervous system, which is your sensory data or motor data, and your brain. So you kind of imagine if a sensory data is being collected from your arm, it can come up, it goes through your spinal cord and goes up to the brain. And if the data is coming from the brain, it can come down from the spinal cord and then expands through the neurons in the body to come out. So coming in and getting out are both need to go through the spinal cord. A spinal cord is made up of 31 pairs of nerves, same concept we described before. These nerves are associated with both sensory data and motor data. If there is damage to these neurons or nerves, the communication with that part of the body in terms of both sensory and motor can be disrupted. Now, if they're looking at the spinal cord and the breaking down of the spinal cord, you have 8 nerves that are originating from the cervical region, and these are called cervical nerves, numbered from C1 to C8. You have a total of 12 nerves that are associated with the thoracic region, labeled as T1 through T12. Lumbar or lower back, there are 5 of them, and you do need to know the number, L1 to L5. And then 5 associated with your sacral region, so S1 to S5, and then 1 that is not labeled here, coming from the coccyx, called the coccygeal nerve, or C1. So if you add them up together, you have a total of 31 nerves. Now, if you have damage that is particular to the thoracic region, typically, you identify as paraplegic. So if the region, the damage is to this, the yellow section, which is the thoracic, it's called paraplegic or paraplegia. You lose the lower part of the body, both in terms of sensory and motor, but the upper part of the body is still functional. However, if the damage is to the cervical region, you basically affect all of the 4 limbs and the thorax and the abdominal cavity. That's identified as tetraplegic or quadriplegic. So basically, again, in that case, both upper and lower region of the body is affected. So that's about it for our central nervous system, and the next PowerPoint will be focused on the peripheral nervous system.